Oregon is uniquely positioned to deal with the high cost of health care. Colleagues, this is truly a dramatic reform which will lead to significant savings, better outcomes, and better health for Oregonians.
So the CCOs actually grew out of the Great Recession. When we came in 2011, we had a $3 billion budget deficit, and about $1.2 billion was in Medicaid. So what states traditionally do is they either drop tens of thousands of people from coverage, or they cut provider reimbursement rates. In this instance, it would be about 40% if we were going to balance the budget. So we said that's just not any way to go. People need healthcare coverage, particularly during the recession. So we decided to create a new care model that would continue to cover everyone, but would try to restrict the growth. And so we focused on how do you get more value for each dollar spent. And the result was the coordinated care organizations, which are a new kind of organization. They're community-based. They have a local governance structure. Local citizens are involved. And they can only grow at 3.4% per member per year. So they have a fixed growth rate. So what happened is we didn't have to cut anybody. In fact, we added another 385,000 people to Medicaid during the recession when the ACA passed. In the first 5 years, we saved about $1 billion. All the CCOs met the quality and outcome metrics, and it really kind of pulled the community together.
The situation was very disjointed. There wasn't a whole lot of coordination of care going on. There wasn't a lot of talking back and forth between providers. That happened not only just within the physical health provider system, but also trying to get physical health information to dentists or to behavioral health providers was a very convoluted process, and a lot of times just didn't work at all. What's really great about the CCO model, when you empower local communities, when you give providers and community members a sense of ownership and decision-making, really amazing things start to happen.
There are probably 1.3 million people today who have health insurance coverage, really good health insurance coverage, that didn't have it before. The local aspect of the CCO delivery model it's the mother's milk of the CCO. It is what makes it work. They're local organizations, so they're in touch with their community, and the savings that you get from reducing the total cost of care is reinvested in the community, in housing, and helping people who are transitioning out of incarceration, for example, in nutrition programs. And so that was the whole concept. Been up for 12 years now. We're, I think, just applying for our third waiver. We've been able to maintain coverage. We've been able to maintain quality. I'm not saying it's perfect. There's definitely improvements that can be made. We're so far ahead of any other state in the ability to expand and maintain coverage, because healthcare is the second largest item in the general fund budget. So when it goes up, it squeezes out our ability to invest in education and public safety and economic development and environmental stewardship. So it's really important. I think the biggest threats to the CCO model are that people don't understand it. People don't remember why we did it. People don't understand the pressure that it's taken off the general fund and the number of Oregonians, particularly low-income Oregonians, women and children, single adults who are working, now can actually not have to worry about where their health care is going to come from. States around the country are looking at Oregon right now, because I can tell you that our economy in Oregon, as it was in 2011, is being propped up by federal dollars, and our healthcare system is being propped up by federal dollars. That's going to end at some point. And we're in much better shape than anyone else because we know how to actually manage those costs. The concern I have with the health authority on this is that they tended to view the CCO more as in a traditional insurance lens. Don't want to get too far in the weeds, but it's called a rate-based system. So basically you set your rates based on what happened the year before. So if you didn't spend that much, your rate goes down. Spend more, you get a little bit more, right? So it sort of takes what we did in the past and locks it into the future. I call it a rear view approach to policy making. Doesn't make a lot of sense. The idea with a CCO was that we would give them a budget and a set of outcomes. They needed to manage inside that budget and produce the outcomes. That's what's created the innovation. That's why the Eastern Oregon CCO is so much more different than the one in Portland or the one down in Eugene, right?
We can't just look at the state as a whole. That doesn't work. We know that doesn't work. We've tried that before in Oregon and it didn't work. So what the CCOs allow us to do is to look at our community and say, this is what our community needs. And we do that by talking to people in our community, talking to stakeholders, talking to community members, understanding their needs, looking at our community-specific data, and then making evidence-based decisions on that information is what we need to be able to do. So that flexibility is absolutely critical. Without it, the CCO structure is not going, it won't work. And that flexibility is also what allows partners to come together and really collaborate and build together. And that's what the CCOs are about, is communities working together to get better health outcomes.
Silos between mental health, drug and alcohol, dental and physical health are being broken down with significant savings being realized. I strongly urge your aye vote. Thank you.
There's a quote I love from a writer named Joel Baker, and he said that vision without action is merely a dream. Action without vision just passes the time. But vision with action can change the world. And that's what the coordinated care model is doing. It's changing the world of how we deliver healthcare services in local communities and across the state of Oregon.